This video includes the description, purpose, procedure, and the evidence base. For the first part of the video, the description of transcutaneous electrical nerve stimulation, in short, TENS. Transcutaneous electrical nerve stimulation, TENS, is a therapy that uses low voltage electrical current to provide pain relief. A TENS unit consists of battery-powered device that delivers electrical impulses through electrode plates placed on the surface of the skin. The electrodes are placed at or near nerves where the pain is located or at trigger point. Indication of TENS are pain of peripheral origin, acute pain, and chronic pain. And the contraindication of TENS are do not use on a person with an implanted pacemaker, history of heart disease, epilepsy, pregnant, and do not treat transthoracic area. Discontinue use if a skin irritation develops.
Now we go to the purpose of transcutaneous electrical nerve stimulation, TENS. So, there are few purposes of TENS using for carpal tunnel syndrome. First is to provide symptomatic pain relief. Second, to stimulate production of endorphins. Next is relaxing muscles. And the fourth one is reducing inflammation.
Theories of TENS. There are two theories about how transcutaneous electrical nerve stimulation works. One theory is that the electric current stimulates nerve cells that block the transmission of pain signal, modifying your perception of pain. The other theory is that nerve stimulation raises the level of endorphins, which are the body's natural pain-killing chemical. The endorphins then block the perception of pain. For definition of gate theory of pain, the gate control theory is also thought to be involved when using a TENS machine. The electrical current stimulates nerve fiber that carry signal relating to touch. The signal travels to the spinal cord, where they temporarily block the transmission of pain sensation to the brain. Prior to gate control theory, there are three: specificity theory of pain. The specificity theory suggests that each pain pathway is separate and distinct. Also, each receptor and sensory fiber has a specific stimulus that it is sensitive to. Intensity theory of pain. This pain theory says that certain stimuli do not have a distinct pathway. Instead, the intensity of the stimulus is determined by the number of neural impulses. Pattern theory of pain. According to the pattern theory of pain, different sense organs respond to the stimuli with different level of response. This is a diagram for gate control theory of pain. For endorphin of pain, transcutaneous electrical nerve stimulation encourages the body to produce natural pain-relieving chemical called endorphins. This morphine-like chemical can also block pain signal from reaching the brain. Furthermore, endorphins are also called the feel-good chemical due to their effect that can improve mood as well as provide a general sense of well-being. TENS activate the body on painkillers. It causes endorphin to be released. TENS signals are transmitted to the brain in a similar way to pain stimuli via the peripheral nervous system and the spinal cord. The signal causes the body on painkillers to be released in the brain. They act centrally and spread out both in the brain and down the spinal cord. They activate inhibitory nerve cell, which is prevent pain stimuli from being conducted on upward.
This study is one of the proof of the effectiveness of TENS in treating carpal tunnel syndrome. The study used of 138 patients with carpal tunnel syndrome. Some of them received only pharmacotherapy as treatment. Some of them received high amplitude, low frequency LH TENS. Some of them received low amplitude, high frequency HL TENS, and some of them received acupuncture as treatment of CTS. The results shown that greater reduction of pain and tinal and phalanx sign was noted in the use of TENS and acupuncture as the treatment. And the conclusion is the TENS is effective and enhanced efficiency of pharmacotherapy treatment of CTS. It reduced the severity of sensory and motor clinical and DEMG manifestations of the CTS. The compression of the median nerve in carpal tunnel syndrome also seemed to be reduced with the significant regression of EMG disorders of the median nerve following LH TENS therapy.
Evidence-based number 2, brain mechanism of pain relief by transcutaneous electrical nerve stimulation, a functional magnetic resonance imaging study. This study suggests that transcutaneous electrical nerve stimulations deliver electrical current through the skin to reduce acute and chronic pain with various etiologies. TENS efficacy has been shown in pressure pain, intense experimental pain, and thermal pain models. Intensity has been shown to be critical to TENS effectiveness, and TENS should be delivered at a strong, non-painful intensity level to produce maximum pain relief. Adequately intense TENS is needed to produce post-operative pain relief, as TENS of lower intensity ineffective for analgesic effects. So the conclusion, this study is the first to investigate brain mechanism of TENS pain relief using fMRI scanning. The S1 and S2 and parietal cortices were activated by non-painful TENS. The TENS effect increased PAG functional connectivity with the lateral prefrontal cortex, probably resulting in activation of the descending pain inhibitory pathway, thus producing pain relief. Temporal summation from repetitive nauseous stimuli was effectively prevented when TENS intensity was increased in a stepwise fashion, suggesting that pain may reduce by this TENS application method.
Intensity appears to be a critical factor in optimizing TENS efficacy, and increasingly it is thought that regardless of frequency of application, the intensity needs to produce a strong, non-painful sensation that ideally is titrated during treatment to maintain the intensity level. According to Sluka KA, timing of outcome measurement requires consideration when analyzing TENS studies, as theory predicts that the TENS analgesia induced should peak during or immediately after use. Meanwhile, Nasser et al. Reported that TENS provided regression of pain scores, sensory latency of median nerves, and phalanx and tinal signs in CTS patients, whereas placebo patients did not show differences in any parameter.
Carpal tunnel syndrome is a common condition that causes numbness, tingling, and pain in the hand and forearm. The condition occurs when one of the major nerves to the hand, median nerve, is squeezed or compressed as it travels through the wrist. In most patients, carpal tunnel syndrome gets worse over time. According to Pedretti 7th editions, Transcutaneous electrical nerve stimulations, TENS, employs electric current to decrease pain. Pain is classified in 3 categories such as physical, physiologic, and psychological. TEN is an effective technique for control pain without the side effects of medications. TENS is an intervention technique that is thought to stimulate the afferent A nerve fibers in the high frequency mode and stimulate the release of morphine-like neural hormones, the enkephalins, in the low frequency mode. Its efficacy as an intervention for pain control is well documented in medical literature. As with other electrical modalities, TENS should be correlated with functional use of the hand. TEN is safe to use, and clients can be educated in independent home use. TENS can be especially helpful with clients who have a low threshold to pain because it makes exercising easier. Castle et al. 2013 state TENS is a therapy of a modality used commonly in occupational therapy. It's considered to be effective through a number of mechanisms, including inhibition of nociceptors, blockade of pain transmissions via efferent nerves, sympathetic blockade, gate control, and release of endogenous opiates. A study by Castle et al. 2013 evaluating the comparative effectiveness of a laser in TENS for the treatment of CTS reported that while the laser provided significant improvements in both pain and neurophysiological parameters, only TENS improved pain scores to a significant degree. In a study combining needle acupuncture, low-level laser therapy (LLT), and micro-M stents to treat CTS pain, Branco-Inazer 1999 found that 33 over 36 hands had more than a 50% reduction in pain after 12 to 15 times of treatments. Weintraub 1997 stated the significant improvement in median nerve sensory latencies after LLT and micro-M stents treatment in this study supports the significant improvements on nerve conditions.